Hi, Mandy. Welcome back. It's great to see you. You made the right choice coming into Welbeck Chiropractic. Now, we've gone over your x-ray findings and exam findings, and we found some pretty significant concerns that I want to go over with you, but we can do that here in a little bit. I'm confident that the problems you came in with are chiropractic conditions, and we will be able to help. Now, since your issues are chiropractic issues, there's a few facts I want to go over about chiropractic with you. It's not new or experimental. It's been treating conditions like yours for well over 100 years. It's actually so popular and successful that it's now the second largest healing profession in the world. Most importantly, there was a study reported on by WebMD where 2 million chiropractic patients over a 4-year period gave chiropractic a 95% satisfaction rating. Now, in the healthcare industry, that's unheard of. So I want you to feel confident that you're in the right place. Another important thing about chiropractic is it's natural. In our world today, that's really important because we've become way too drug dependent. Our bodies have this amazing healing capacity that's always going to be better than anything man can create, like a drug. We need to rely on our body's healing ability first and always use drugs as a last resort. Have you ever thought about how the body's able to heal itself? Even with something as small as a cut on your finger. First, it's going to stop the bleeding, and then it'll close the cut, and before long, you can't even tell where the cut was at. The body heals itself naturally through a network in the body called the central nervous system. It knows better than we do what it needs to be healthy. When there's no interference to that system, it can better diagnose itself and better heal itself through the nervous system. The first choice of healing should always be natural and not drugs with their harmful side effects, with the risk of their harmful side effects, or even addiction in some cases. Drugs have their place, but they should always be used as a last resort. So what got you here in the first place? Let's talk about your condition. Why do you have the pain that you have? Why do you feel the way you do? Well, first of all, this situation didn't just start yesterday. It didn't just start when the pain started. Pain is usually one of the last symptoms to show up in conditions like these. Your issues have been building up over time. In fact, it probably started with the trauma of your childbirth. If you've ever talked to anyone who's witnessed childbirth, they can tell you that trauma to the head, neck, and spine, it's incredible. And it didn't stop there. If you think back to the hundreds of slips, falls, and accidents that occurred while you're a child, you've actually needed chiropractic care all throughout growing up. If you think about it, it's amazing any of us are still alive after 5 years old with all the hits, spills, and traumas that have occurred. And also, all of those traumas were left untreated. The point is, you've needed chiropractic care since you were born. It would have saved you from a lot of the problems and wear and tear you've been experiencing. And also, if you have kids or you're planning on having kids, you need to keep this in mind because they're probably going to live to be 100 years old. And we want our kids to have great mobility throughout their whole lives, right? It's impossible to know the number of slips, falls, improper lifts, and traumas that you've experienced through your life. That's why I say it isn't just one thing that got you here. You have years of wear and tear already. Keep in mind that that's with no prevention, no treatment, no care, and really no effort to offset that wear and tear. Let me give you an example. Let's talk about your teeth. Let's say you'd never been to the dentist. Never brushed your teeth. Never. From childbirth until now. What kind of condition do you think your teeth would be in? Pretty ugly situation, huh? You might have a lot of cavities. Some of your teeth may have even fallen out. Through the years, your body has experienced nerve and tissue damage that has been left untreated. Kind of like when we were talking about your teeth. You're very fortunate that you're not in more pain than you are right now. Keep in mind that this situation was created over time. Keep in mind that this situation was created over years of neglect. It's not going to be fixed overnight. With one adjustment, it's going to take some time. Let me give you another example. Let's say you gained weight over a period of time, like 10 years. And once you realize that you want to lose the weight, you want it gone now. 10 days and you want it gone. But we all know that's not going to happen. It's going to take some time. And this will too. We'll talk about the time part here in just a minute. But first, let's talk about where you are right now. Let's talk about your exam findings. What's the result of all this untreated activity? All of this damage that you've been accumulating? Well, here's the deal. Your spine has been pushed and pulled out of alignment. This is causing less mobility, less flexibility, and more irritation on your nerves that are coming out from in between the individual bones in your spine. These bones are called vertebra, and the medical condition I'm talking about is subluxation. The reason why this condition impacts your health so much is because the nerves come out of your brain and they travel down, communicating the commands from your brain to the rest of your body. At the end of these nerves are your muscles and your organs, and this is how the body knows how to function and heal itself. So you came in with low back pain. Let's talk about some of the things associated with the nerves that come out of this area. So you have groin pain, pain down your leg, maybe even abdominal discomfort. Do these sound like any of the conditions that you have? When the nerves are pinched, it creates interference from the brain to all these areas. It's the same type of effect we get with our cell phones. So when you're on a call and there's interference to that call, we lose it. So we run around and we try and get signal so that our call can go through. What's happening in the central nervous system is there's nerve interference, and your body's communication is being cut off. The result is going to be pain like you have and disease to all of the associated areas. Subluxations are more than just neck or back pain. They can cause many other types of disease as well. When we remove that kind of interference so the body can heal itself, you will most likely experience better health in many areas in your body. Everywhere those nerves go, not just the areas that you're experiencing pain or discomfort. So, there's 4 types of spinal degeneration. There's 4 phases of spinal degeneration. Much like cancer, the longer you let it go without treatment, the more severe the stage is going to be, and the more severely it's going to affect your health. Spinal degeneration works the same way. We need to start treatment and prevent further degeneration now. I will currently place you at a phase 2 of spinal degeneration. Now we're going to look at your x-rays so I can show you the level and exactly where I'm talking about on your spine. Now we'll go back to this pamphlet over here, and I'm going to circle the phase that you're in. And now we're going to go back and we're going to compare the two so you know exactly what I'm talking about with your condition. Once we're done with this, you can take this to your significant other and you can go over it with them. So I think we've spent enough time on your condition. Let's talk about the solution. The solution to healing this issue and getting you the wellness you are looking for is a series of adjustments. I'm going to start adjusting your spine into the proper alignment. Let's talk about what the adjustment does for you. When you're being adjusted, I want you to be aware of what is actually taking place in your body, since the adjustment really isn't something you can see inside you. There are 3 things that are happening. So 1, I'm removing the nerve interference so your body has a 100% chance to heal itself from the pain and sicknesses associated. 2, I'm removing the nerve interference so your body has a 100% chance to prevent pain and sickness. And 3, I'm removing the nerve interference so that your musculoskeletal system can experience less wear and tear, allowing for better mobility throughout your whole life. You might have noticed that before I said your healing process was going to take a series of adjustments. This is for the same reason that an orthodontist doesn't reach into your mouth and move your teeth into the proper place in one visit to their office. They say it's going to take time. It's going to take a series of visits, and over time, your teeth will get moved into the proper alignment. This is exactly what we're going to be doing here. The truth is, your spine has been misaligned for so long that your body thinks that the misalignment is normal. We are going to have to retrain it. We are going to have to adjust your spine, and it's going to go right back out. This is going to be like a 3 steps forward and 2 steps back process. We will continue to adjust your spine until we have it in the proper alignment and stabilized. But like I said before, it's going to take some time. That's why it's really important for you to follow your care plan to a T. Don't miss any visits. This is what it takes to retrain your spine to get your health back. You can see why this is important, don't you? The number of these treatments and timing is essential for stabilization. So we've divided your treatment plan into 3 phases, or 3 parts. We have the pain relief, stabilization, and wellness. We've got to get you out of the pain you're in. Every person's going to respond a little bit differently. Your first phase of care is going to include treatments every day this week, and then 3 times a week for the following 2 weeks. We'll be applying therapies to help supplement your adjustments. I feel confident at the end of the first phase, you're going to be feeling pretty good. You might even be completely out of pain. You might be thinking, I'm better, problem solved, I'm done. But I'm going to tell you that's not the case. Your condition at this point is going to be so fragile that although it's true, you might be completely out of pain, it's likely that any wrong lifting or any wrong turn is going to put you right back in the situation you are now, or maybe even make your condition worse. At that point, I'd have to start over at phase 1. That's why the second phase of care for you is actually more important than the first phase. We want to stabilize your condition so that you're not in that fragile state anymore. Before we start the stabilization phase, we will do a progress report. We want to make sure you're ready for the stabilization phase. Also, we want to see if you need any less care than I initially thought. Certainly, I'm going to cut back care if I can. Assuming you are ready, we're going to graduate you to the second phase of care. This will be easier than the first phase for you. You will still need to come back for a series of adjustments, but only 2 times a week for the following 3 weeks. At the end of the second phase, based on all of the cases we've treated like yours, I believe you're going to be in a stable condition. Once again, we'll do a short progress report to make sure this is the case. Once we consider your condition stabilized, you will then graduate to phase 3 of care. Okay, let me tell you why this phase is essential for your health. The one problem we have with your case is I'm never going to be able to eliminate the cause of your problem. You are not going to stop doing what brought you here in the first place. You are going to keep living your life. You will still be doing the very things that caused your subluxations to start with. Just as with your teeth, when you get them cleaned, they don't stay that way. They could, but you would never be able to eat again. And we all know that's not going to happen. You're going to have to keep cleaning your teeth and getting them maintained over and over again. Same way, you're not going to stop the activities that caused your nerve interference to start with. I don't expect you to. The difference this time is instead of allowing the wear and tear to wear you down until you can't move, putting you in the condition you are right now, we're going to provide treatments to counteract your wear and tear. Prevention is always easier than an overhaul. Wellness care is always easier than sick care. We will make a recommendation for wellness care when we get there. Our overall goal here is wellness. What you need, our overall goal here is wellness, not just the pain relief of the first step. Natural wellness is what you need, and that's what we can offer here. In order to get you to that condition, there are 2 things I'm going to need from you. First of all, I'm going to need for you to make all of your appointments and treatment times. As we described earlier, it's the number of treatments and frequency that will make chiropractic work for you. Second, I'm going to need you to attend a special class we have that's essential for your health and well-being. Also, it's a topic I really think you're going to enjoy and benefit from. Not only for now, but for the rest of your life. It's helpful information you have never been taught before. It's called How to Stay Young for the First 100 Years. If your family would attend, I know they would benefit from it as well. We have 2 times next week that the class is being taught. Monday at 8:30 or Thursday at 4:30. Which one of these times can I say that you would attend? Okay, well, if you don't have any other questions, let's go ahead and start with our treatment. Thanks.